Hi, I want to welcome everyone for watching this evening. You've tuned in to Sanctuary Functional Medicine, and I am Stephen Paske, the Relations Manager, and I'm here with Dr. Eric Potter of Sanctuary Functional Medicine, and we are here this evening to have a dialogue and let you be a part of that conversation. We're going to discuss MTHFR, and we're also going to discuss what is functional medicine. How does that play a role in MTHFR, and what is new in medicine today? What is different about medicine? So we're glad that you tuned in. We hope that you're able to learn some things that you have not learned before, and at the end of our session, we're going to invite you to ask some questions on YouTube. So we hope that you have learned a lot from this, and we look forward to hearing from you as well. So, without further ado, I'm going to start the conversation by just delving in and asking you, Dr. Potter, can you give us just a brief synopsis of what is, we hear this all the time in the news, MTHFR. What is MTHFR?
So, thanks for this opportunity. I work with patients day in and day out with MTHFR. It's not the only thing I do, but because it plays such a central role in patients' health, it is coming out almost every day, sometimes 2 or 3 times a day. MTHFR is something that we've known about for a number of years, but like many other genetic issues, we haven't had the technology to really draw it out of enough people. The tests were too expensive, so there weren't that many people we were testing it in. As testing costs have gone down greatly, we can get a test now that will tell us how you're processing folate. So everybody thinks about folic acid. You eat bread, it's fortified in folic acid. You think, oh, great, all I do, if I eat enough bread, if I eat enough green leafy vegetables, I'm going to get that. Well, it's not quite that simple. This MTHFR is one little gene in your methylation cycle. And we can talk a little bit later about what a methylation cycle is, but for the moment, MTHFR takes inactive folates and moves it, the final step, to an active folate. Many of our vitamins, actually probably most of our vitamins, need to be activated. You eat them, your body does something with them, and then makes them able to be used in enzymatic reactions, to do process and different things in metabolism. And so this takes inactive folates, turns it into a methyl folate. Then that methyl folate can be used in the B12 methylation cycle. And then we can talk later about all the different things that does. It ties into a lot of different parts of your health, from your muscles' energy source to control of genes through methylating your DNA, to thus affecting cancer. It also affects your cell membrane health. So the health of your cells, the little membrane, the package that all your cells are in that you need for our health. For those membranes to be nice and soft and flexible and be able to move things in and out, you need a lot of phosphatidylcholine, which one of the things you need is methyl groups to make that. So a number of other things, but this MTHFR stands for methylene tetrahydrofolate reductase. Yes, that is a hard thing to say. I get tongue-tied still when I say that, obviously, as I just did now. So ultimately, talking to patients, calling MTHFR is a whole lot easier than trying to pronounce that. But like I said, it's one gene taking inactive folates, making into an active folate so that your body can use it in the methylation cycle, and then do a lot of other things downstream from that.
Great. So, having defined it, if let's people out in the audience and they're listening this evening and they're watching and they're thinking, okay, I have MTHFR. Okay, I've done the test. Maybe they've done the MEN23 test, or they've had some blood work done. Do you need to do increasingly more testing? I mean, what do you do once you get down that road and you think that you might have MTHFR?
So every person that comes to me saying, oh, I've been tested, I've got MTHFR, is different. They're unique. Each person, because just because you have an MTHFR, one, doesn't mean you have a disease. It just is part of your metabolism and puts you at risk for different things. So one way I like to describe it is, if you have a suspension bridge, and it's got all the cables across of it, you look across that bridge and you see one cable out. Like, oh, I'll drive my car across it, no big deal. However, the semi-truck driver that comes across and says, oh, there's 3 or 4 cables out. They're like, I don't know that I want to take that heavy load across that bridge. Well, MTHFR, that gene that we talked about, is kind of like that. You know what? If you're not putting toxic stresses, if you're not putting genetic stresses, or you don't have other genes that play a part with that, it may never cause, you may live to 100 years old, never cause any problems. So when a person comes in, first of all, I've got to take a good history to know, one, what symptoms are they having, what diseases might be playing a part in those symptoms, finding out what toxic exposures they've had, finding out about their nutrient exposures. Are they getting a good amount of high nutrient foods, or are they eating a lot of processed foods which really don't have much nutrients at all? With that, I can look at that patient and then start to say, okay, this is what we need to look at. Sometimes, in the last week, I've looked at patients and they say, well, it's my MTHFR, right? I was like, well, no, we need to, that's playing a part in it, but it's not the only piece of the puzzle. There's other pieces of the puzzle. Sometimes it's hormones, sometimes it's thyroid, sometimes it's progesterone, sometimes it's the fact they have heavy metals, mercury from amalgams. So you got to look at all those different pieces and see how MTHFR fits into it. So just like putting a puzzle together. Puzzle 1, you got to have all the right pieces, and 2, you've got to put them together in the right way. It's not just about that one piece.
Interesting.
So the way I approach it, getting a good history, looking at the person as a whole, which is part of functional medicine, his whole person, whole life, not just looking at one 30-minute sit down with them, but actually spending an hour, hour and a half with them, getting that history. Then if I do need to do testing, sometimes it's a methylation panel where I look at their SAM-SOL ratio, which is 2 of the products in that cycle that downstream in the B12 part of the methylation cycle. Sometimes it's looking at their other B vitamins, because that's one thing. Just because you have enough methylfolate doesn't mean your methylation cycle is working. You have enough B12, the right forms of B12. You've got to have other B vitamins, magnesium, zinc. You got to have ATP from your energy cycle. So all those things are, once again, in that methylation cycle like a puzzle.
Wow.
If you're missing a piece of the puzzle, it's not going to work as well.
It's complex.
Yes, but a lot of fun.
Complex, but a lot of fun. I'm glad it's fun for you, and I'm glad you're so passionate about the issue, because you've done quite a bit of work, and so this is really good for us to learn about together. I know one of the questions, and these are just commonly asked questions that people have asked, and I'm starting with tonight, so I'm hopefully going to be touching on some of the questions that people who are tuning in have. So here's one that I get commonly. What is the difference between 1298 and 677 in reference to this MTHFR?
Okay, so when someone who's studying genetics or epigenetics looks at these genes, they look for these numbers. They're SNPs. That's, once again, like MTHFR is a simple way to say something. SNP is a whole lot easier than saying a single nucleotide polymorphism, especially if you say that over and over again during the day. So a SNP is one letter chain in the DNA code which makes up a protein. So it's like the alphabet change for the letters making up a word for what your protein is going to be made of. 677, 1298, those are just numbers along that chain. So it's kind of like saying, oh, page 30, look what's on page 30. This is, look what's on letter number 677, 1298, or if you look at other genes, they'll each have numbers for that. Okay. So it's a simple shortcut way to say, 677, 677 letters into that code, there's a change. Okay. So 677 is probably the more important of the two, in the fact that there are studies that clearly show that the one SNP, each person has two genes, one from mom, one from dad. So you can have one or two. So you can be heterozygous, meaning you have one copy, or homozygous, meaning you have two. Okay. If you have one, you're probably about 30% slower in making that inactive folate into an active. If you get two of the 677, it's probably more in the range of 60 to 70%. So a good way to look at it is, if you had a 10-lane road in LA, you're driving down that 10-lane road, there's another 10 cars, but it's not that crowded. All the cars are going down the 10 lanes perfectly. However, you have construction. You shut down 3 lanes. 10 cars, still probably doing fine. However, you add a couple hundred cars, might have been okay in the 10 lanes, but you go down to 7 lanes,
Right.
you took out 30% of the lanes,
Right.
could get backed up.
Right.
Now, you go down to 3 or 4 lanes,
Now you have an issue.
you've got a big issue. In LA, you've got a major shutdown.
Right.
So that's what MTHFR does. It's like closing those lanes down.
Interesting.
And if you don't need that much methylfolate, it may not make that much difference. But if your body's in a high need state for methylfolate, it's going to be a problem.
Interesting.
And 1298, on the other hand, probably slows it down, depending on who you talk to, maybe 15 or 20%. With 1 copy, with 2 copies, maybe 30 or 40%. When you look at what happens if you have 1298 and 677, there's not really any good studies out there, at least not that I've seen, that say definitely, oh, if you've got 1 copy of each, it's 40% down, or 2 copies. There's some that are estimating that if you had 2 of each, you're probably looking at only 10 to 20% function, but there's not really any good studies out there that would say absolutely. Whereas the MTHFR 677, there are some pretty good studies that tell us approximate where that is.
Okay. Good. So, leading off that, the distinguishing factors between 1298 and 677, can you, and again, a commonly asked question, can you just take, methylfolate and say, oh, methylfolate's going to help resolve everything. This is what I always hear, this is one of the key words. I'll just get on methylfolate and I'll fix this.
It would be nice if it was that simple, but that's what happens to a lot of people that come to see me, is somebody said, oh, just take a little methylfolate. Take 1,000, take 5,000, maybe take some Deplin, which is a pharmaceutical form of 7,500 or 15,000. So it's like a huge dose.
Oh,
Now, some people can take that, actually do very well. There are studies that show that Deplin, that higher dose where you have 7,500 or even 15,000 of methylfolate, helps with depression. Some people can handle that. The ones I see are the ones that were given those higher doses and have side effects. Because just like many other things in our body, you can have too much of a good thing.
Sure.
It's not just have enough and you'll be fine and take as much as you want. But it's like driving down the road. You don't want to be in the left-hand ditch. You don't want to be in the right-hand ditch. You want to be in the middle.
Right.
So with methylfolate, the reason we take that, if you have MTHFR, or why I recommend that, is if you just give the folic acid and it gets backed up behind that, because it's kind of like the traffic jam. All that's backed up, it's going to cause other problems. So there are some studies looking at that those extra folate groups can have negative effects on your immune system, can actually slow down your neutrophils, which are one of your immune fighting cells. It can have some other negative effects. So you don't want to just give folate, but then you want to make sure you give the right amount of methylfolate for 677 in particular. Although then there's also, let's just confuse it a little bit more.
Yeah, please.
Folinic acid.
Okay.
So methylfolate is really the active form, but folinic acid is one of those steps just before it. But yeah, your body actually uses that too. Patients with MTHFR 1298 actually need a little more folinic acid. In addition, not as much of the methylfolate. So not to get everybody confused, but basically the methylfolate, you're giving it, you're skipping, basically you're dropping in things past that roadblock. It's kind of like you're just just picking up and putting the cars over that roadblock where they're back on the 10-lane road. It can keep going. The folinic acid is kind of helping your body bypass and use that other pathway.
Mm-hmm.
So kind of taking that off ramp and sending it down to another place where your body uses it for neurotransmitters
Mm-hmm.
and also for interactions with your DNA, making some of the bases for your DNA, actually the letters that we've talked about. So it's kind of folinic acid sends down the side path, methylfolate skips that altogether and picks up and takes the cars on the other side of the roadblock.
Wow. So that is why you're the doctor, for one, because that's quite a lot to take in. What I got from that in my mind is hearing you say we're all individuals, right? And so like our bodies are all going to
Yep.
Is that accurate to say
Yep.
that we all process it uniquely?
Yes.
And so forth? So that leads me to this question. commonly hear this too with MTHFR. What is Deplin? Is it good to take Deplin or bad?
So Deplin, like I said, has much higher dose. Typically, I will start off with 500 to 1,000 micrograms, whereas Deplin is 7,500 micrograms, or the high dose is 15,000. So it could be 7.5 to 15 times the dose I will often start with. So it is a pharmaceutical. It's still methylfolate. It works in some patients. Like I said before, psychiatrists will use it a lot because they will say you're taking Zoloft, Prozac, Paxil, one of the SSRIs, the selective serotonin reuptake inhibitors. It has been shown in studies to augment, so make more effective those medicines. So patients with depression often do better, recover faster when they're taking the Deplin. So it has a role. Mm-hmm. Once again, though, I see the patients who come and say, they gave it to me, I couldn't sleep, I had jitters, I had teeth chattering, I had all these other problems.
Wow.
So with those patients, I start back at the lower level and do some other things. Create a unique protocol, not just a one-size-fits-all, let's throw some Deplin at it. Look at their other B vitamins, make sure those are enough. Look to see if they have toxins like heavy metals. So it's just a matter of working through those things. But Deplin, ultimately, it's a good thing in the right patient.
In the right patient, yep. So, and you hear this, I hear this more than anyone talking with patients, in terms of like methylation. So what is a methyl group?
Methyl group. We talked about the methylation cycle. We've talked about methylfolate. Let's just take a moment in organic chemistry. One of the least favorite things that many pre-med students go through, because you're learning about how all these molecules, all these things that make up our bodies, living organisms, right, how it all fits together, because it's a multitude of different things. But one of the simplest parts is a methyl group. It's simply one carbon atom with 3 little hydrogens. So hydrogens, like it's part of water, hydrogen gas, carbons, which is kind of the basic building block of living matter on Earth. So you put those 3 hydrogens on a carbon. It has one more arm that can kind of grab onto things. So you can stick that onto DNA. You can stick that onto proteins, carbohydrates, different molecules to change them from one thing to another. One of the places it's used is in detoxifying our hormones. So actually one of the ways we get rid of our estrogen, so both men and women have estrogen, obviously women have more, mm-hmm, but one of the main ways you break that down and inactivate it, because if you have too much, you put, there's risk for breast cancer, other female cancers, is put a methyl group. Okay. So it kind of, imagine if you had a key and you just stuck a little extra piece, a little solder, stuck a little metal piece on there, it's not going to work in the door anymore. Right. So that's what a lot of these hormones are like. You're adding a little something that gets in the way of it working. It won't fit in the key, the lock anymore. Oh. So methyl groups can be used there. So it's a very simple thing, right, but it's a very good thing that your body uses to turn things off and on. Whether it's turning DNA off and on, so you don't make a protein, hormones off and on, sticking it to something to turn it off so it can't be toxic to your body anymore. So it's used in a lot of different places, but once again, very simple. Carbon, 3 hydrogens, 1 extra arm, it can grab onto things, and methylfolate kind of carries that around, puts it in the B12, you put it on this thing called SAMe, mm-hmm, acetylsol methionine, another nice fancy big word. Very good. And then from there, different enzymes can attach it to different places.
So the phrase "fearfully and wonderfully made" comes to mind after you said all that to me.
Yes. It definitely, when you're staring at these charts and you're hearing a patient's story and you're thinking about, okay, how does this fit it? How do these tests, these symptoms, these genetics fit together? And you're like, this didn't happen by accident. Yeah. So we are amazing creations.
Amen. What diseases do we see connected? This is a big one. What diseases are connected with MTHFR?
Whole bunch of stuff.
Oh, that's what I was afraid you were going to say.
So there are things that seem to be directly connected. Okay. Then there are a lot of things that are indirectly connected. So a good way to think about it is if you looked at a spider web and you touched it in one place, 1 inch away, it's going to move a lot.
Mm-hmm.
So there's some things that are very closely. We know those things. But then there's going to, even 2, 3, 4, 5, a foot away on that spider web, it's going to move.
Right.
So those are some of those things that may be 3 or 4 steps away that the methylation, methylfolate has an effect, MTHFR. Some of those are going to be cancer, because if you're turning off a gene that controls, it's kind of a good way to look at it. If you're turning off a gene that's a brake,
Mm-hmm.
and you're all gas, you have a lot of growth, you have tumors.
Right.
On the other hand, if you have a gene that's a gas pedal and you pin it down to the floor with a methyl group and it's just all gas, the brake, it can't do anything. I mean, you may do like I do occasionally, drive with my emergency brake on. They're great when you're holding still, but you put enough gas, your car's going to go anyway. So that's what happens a lot of times when in cancer. There's also, because one of the things your body does is break down histamine.
Okay.
Using methyl groups. Now, our bodies have multiple ways. Again, fearfully, wonderfully made. When you need to get rid of something, it's usually not just one road. It's not one road out of Dodge. There's 2 or 3 roads. So methylation is often one of those roads. Sulfation, glucuronidation, oxidation, hydroxylation. There's a number of things. If you've studied it all, if anybody's looked at phase 1 and phase 2 detoxification, some of these things are going to sound familiar. But methylation is one of those things. Sometimes it's one of the major parts. It's like the main road out, it's the interstate going out. Sometimes it's just a side road, and it doesn't make that much difference. So with some of these diseases, if like I said, for example, the estrogen we were talking about a moment ago.
Right.
There are some studies show that if you're not methylating your 16-hydroxyestrogen, or your 4-hydroxyestrogen, attaching a methyl group to turn them completely off, kind of close the door, get them out, turn them off completely, you actually can be higher risk for some female cancers, ovarian, breast cancer.
Okay.
So that's a place.
Okay.
Colon cancer, it's been implicated in some genetics there. Then hormone imbalance, if it can keep one of the things when you add a methyl group to that hydroxyestrogen, the hydroxy still has a little bit of effect.
Okay.
So you may still have some estrogen dominance, which is a big term these days. You may have some other negative effects from there. So hormone imbalances.
Mm-hmm.
One of the ways that you deal with mercury in your body is putting a methyl group on it, or using other toxins that you're trying to get out. So if you're not, those toxins are going to build up. They're going to create more inflammation, more oxidative stress. So this is where some of those indirect things is tied to inflammatory, diabetes, metabolic syndrome, people that have trouble losing weight because they have inflammation in their body. You check their CRP, one of the inflammatory markers, and it's elevated.
Right.
Doesn't mean it's MTHFR, but it's one of the things I think through. There's some looking at the histamine I talked about. You're breaking the histamine down.
Right.
So people have histamine intolerance or allergies. Could be that you're undermethylated. So if you have enough methyl, I had somebody the other day, they were like, I ate something. They're like, I don't know what it was that causing this. I'm itching all over. I'm starting to get a little red. It's like, take some methylfolate and take some quercetin. Within 30 minutes, all gone.
Wow.
So I have that a lot. Patients that are having trouble controlling their histamine.
Right.
Sometimes it's a matter of methylfolate playing a part in that.
Wow. That's amazing. So in other words, if you have MTHFR, it needs to be looked into. It's not something to take lightly.
Not something to take lightly, but just because you have MTHFR doesn't mean you should panic.
Right.
Doesn't mean you need to, I got to run to the doctor. And I'm like, are you hurting? No. Are you depressed? No. Blood pressure's good. You go through all these things, which is another thing. Couple other diseases just thought of is heart disease. So MTHFR is connected to some clotting disorders, so you can have a little higher risk of blood clots, heart attacks, and affects blood pressure as well. The other thing for a lot of parents out there is the fact that it plays a part with some of the spinal cord defects in babies. It can be related to miscarriages, and it can be related to some studies. It's not one of those things that's a direct link, but the autism, Asperger's, autism spectrum disorders, There are some studies that show that it can be. It's not the only thing. A good way to put it is there's not really one autism. There's autisms. So I do think it's related to some, but not necessarily the sole cause or the main reason in every single person that has autism. That's going way too far.
Okay. All right. Well, let's move on to some other questions because it's been very helpful so far. What diseases do we see connected? We've talked about that with MTHFR. There's a whole slew of them, which gives people reason to do some further research. Obviously, I, for one, didn't know that many were involved with MTHFR. I knew of a few because I have a family member who actually has MTHFR, one of the mutations, but I had no idea there were that many diseases associated with that. So it's very intriguing to learn about how much it affects our body. In addition to everything we talked about with MTHFR, are there other genes that we're supposed to check, that we're supposed to look into?
So some patients come, they've gotten MTHFR tested. They know about their 677 and their 1298. They'll think, okay, well, like, do I just take some B vitamins and some methylfolate and it's all better? Well, sometimes it is.
Right.
But a lot of patients, by the time they get to see me, it's like, well, you probably got other roadblocks.
Right.
So another analogy or metaphor that I'll use is if you're going down a road, if there's stoplights, if you only hit one stoplight, you're like, okay, great. You keep everything else is smooth.
Right.
But when you're looking at that methylation cycle, there's multiple places that you can have stoplights. Each gene can have some SNPs. It could have deficiencies in the vitamins or cofactors it needs.
Mm-hmm.
So you can catch that red light at multiple places in the methylation cycle. So, for example, MTR, MTRR. That's where the methylfolate, the folate cycle, and the B12 part of the methylation cycle meet. There can be SNPs there. Again, those little letter changes where it can slow down or even speed up. Some enzymes speed things up. So they may use your vitamins up quicker. You can also have the MAT, which actually takes methionine and transfers it one further step. You can have HCY, which takes your accidental homocysteine kind of after your methyl group's been used and is trying to go back around the circle again. You can have CBS, which actually is one of the ways you get some of that out of the methylation cycle, because if you get too much, too many methyl groups can be a problem, as we mentioned before. You also need that CBS, otherwise you could make glutathione. Glutathione is one of the main antioxidants our body needs. So it's kind of like the insulation from oxidative stress in our body.
Wow.
So and you could go, like, if you look at 23andMe, one of the big testing companies.
And that's one of the main ones you
right.
use. Yeah.
So a lot of people come and it's literally there's tens of thousands of SNPs.
Right.
Now, there may be 10, 20, 50 SNPs in one gene they've checked, but ultimately there's probably 50 to 100 different genes I can look at.
Wow.
And help me look at a patient's symptoms and say, oh, this makes sense. You've got roadblocks here. You've got narrowings that's slowing things down in multiple places. So yeah, you got enough methylfolate, but you're slowed down in 5 other places.
Wow.
So it helps me to kind of get a better understanding. It's like going into a factory,
right,
and being able to look along the production line and see, oh, there's a problem with the production. At this point where they put on the tires, there's something over here that's not working. The track has got a bump in it, and they're having to lift the car and move it over that every time. Then over here, there's another bump where they literally had to, it's broken down completely, and they've got to carry the car. 10 workers carry the car from one side to the other. So those genetics help me see where those potential roadblocks are.
Okay. All right. So it's very insightful for you to do that.
Yeah. So one way I like to, I joke with patients and say, some people like to jump out of airplanes to get their adrenaline going.
Right. Not me.
I like to look at 23andMe because I can sit there and look at this and put puzzle pieces together.
Okay.
And see how I can help patients.
Interesting.
And find things that haven't been seen before.
And you've referred to that several times just talking tonight, that it's a puzzle.
Yes.
Yeah, and that's the way I always look at it, and especially hearing you talk about it, I can hear how complicated everything is. So we talked about the diseases linked to MTHFR, and we found out that there were a litany of diseases that potentially could or could not be with MTHFR. Then we talked about, are there other genes to check? So the one test that I know that you do quite a bit is the MEN23. But in general, when patients are looking into this, how do you get your genes checked? Other than MEN23, what does the person do?
So, like I said, there can be some patients that will come in. They've had a blood test by another doctor that takes some blood out, takes some DNA, checks 677, 1298, and there's a couple of things else you can do there. There's some other places where you can get individual genes. You can do cheek swabs where basically a Q-tip, go inside the mouth, put in a little thing, send it off. Then the 23andMe is actually spitting in a little tube, filling it up, closing it off, and sending it off to the company, and they take the DNA that's come off the cells inside your cheek and do that. Now, what's the difference? Is it just cost? Doing the individual genes can be $100 to $150, sometimes $200, sometimes a little bit more, depending on who you're getting it from.
Yeah.
And you only get that one answer. You think, well, should I do 23andMe where $199 or so, and I get 20, 30,000? Well, the issue is, you may just want to know. It's kind of, you can know too much.
Right.
And there are insurance issues that we're supposed to be protected, our genetic information. But sometimes people, getting 1, 2, 3, 5 genes is all they need to test.
Okay.
Versus going and get everything out there, especially with kids. We don't know what the genetic privacy is going to be like in 20 years if you're filling out insurance papers. Oh, do you have to tell everybody that you've got these 20 SNPs? Whereas if you've just only done 5, you only have to disclose that. You don't have to, you don't know the rest. Now, somebody comes to me, they've been through 10 doctors, they've been through $5,000 worth of tests, they're still having symptoms. That's where I often go back to 23andMe and say, all right, there's a puzzle piece that doesn't make sense.
Sure.
This should go over here to this, and there should be a straight line connection, but something's not working.
Sure.
Then go back and look at those genetics and say, oh, that explains why you're going this way instead of going straight line in a metabolic process.
Yeah.
So there's a lot of different ways you can do it. Like I said, the easiest way, obviously, is spitting in a tube or taking a Q-tip and swiping it in there. And different companies can do that. Okay. And there's 23andMe is one of the earlier ones in the market. There's some other Ancestry DNA. There's 2 or 3 other ones. There's some other companies that are looking at specific how you detox or how you process medicines. Okay. So like a Genomind, Genocyte, where they're looking out there and say, oh, if you take these different classes of medicine, which one are you likely to not process well? So I have a lot of patients who will come in and say, oh, I took this medicine, it didn't do anything. And I'll look at their genes like, oh, well, as soon as you take that medicine, you chewed it up in an hour versus somebody else over here, it lasted a day in. Or I get the other patient who says, I took the tiniest dose of this medicine, I had the worst side effects. I look at their genes, oh, when you take that medicine, it probably lasts a week because you break it down so slow, it's going to last. So by the time you take your 3rd dose, you're sky high on risk for side effects. So those are some of the other, when somebody, coming in, where specifically they've done a lot of testing in regards to depressant medicines and ADHD type medicines, okay, about how they're processed with different cytochrome phase 1, phase 2 detox.
What I do hear in some of this medical expertise that I'm getting drowned in is, for a simpleton like me, what I do here is this, and having worked with these patients, we get patients all the time that have been to multiple doctors, and they say, my doctor he's not trained in MTHFR, I need you guys to help me. And from everything you just described, it's quite obvious to me, one of the key ingredients that you put into all this, in addition to your certification expertise, is great amounts of time, it sounds like to me, to
yes.
be able to explore this.
Yes.
Can you talk about, just as a side note, I mean, when a patient sees you for MTHFR, what is unique about that process, as opposed to just saying, well, I'm just going to go to my standard doctor, and Yeah, he doesn't know anything, but we'll just kind of wade our way through it. Why would a patient see you for MTHFR?
There's not a short, there aren't shortcuts in regards to MTHFR. When somebody has MTHFR, it connects to so many different things in your in the metabolic pathway, the hormones, the detox system, control of DNA. You have to literally sit down and think through all those aspects, kind of map out the territory, and then look and say, okay, what pathways is this person taking in their metabolism? So there's not, it's kind of like if you said, oh, it would be nice to have a teleporter, if you watch Star Trek, to say, oh, I just want to push a button and I'm going to go halfway across the universe. We don't have shortcuts in MTHFR. So if you go into another doctor and they're going to try to sort through all that, all the different details, all the things that go into that in 15, even 30 minutes, it's just not going to work.
Yeah.
So that's why taking the time, having initial visits where I'm sorting through these things an hour, hour and a half, sometimes longer, you really have to get a lot of details. Okay. One of my favorite paintings is a painting by Albert Bierstadt, Hudson River School. So you may not recognize the name or that school, but literally it's the ones where it's the Great West in the 1800s, where you would look in this picture, it would have a mountain, it would have a valley, it would have clouds. It might be the size of a wall, so it might be 10 to 12 feet wide, 8 to 10 feet high. But then you step back, you're like, wow, this is a huge picture. This is covering huge amount of landscape. But then you step up to it, and there's a groundhog this big. And there's a rabbit over here this big. And there's the little flowers over here in the background and different things. MTHFR, you can't just stand at a distance, take a survey, and say, oh, here we are. Let's do this. You've got to step back. You look at that, get your bearings. Then you step up to the picture and say, oh, here's some details. Oh, here's some more details. Then you can step back again and say, all right, here's what we need to do to get around this fox that's over here in the corner, and to get over here to the rabbit that's on this side, and avoid the log with a wolf sitting under it on this side. You've got to weave this way. It's going to be different for each patient. So that's the other thing. I can't just walk in and say, oh, here's your protocol. Just call me in the morning.
Right.
Go A, B, C, D, E, and call me in the morning.
Right.
Each patient is going to, one patient, they're going to go this way. Another patient, they're going to go that way.
Sure.
Next one's going to spin around and do this.
Sure.
Sometimes we get that done in a couple of months. Sometimes it takes 6 to 12 months to get someone's methylation cycle, all the things that are affected with that, back in line.
Wow. So it takes quite a bit of time. All right, I'm going to go actually do one more question, and I know we have people out there who are asking questions, and we're inviting people to write in questions that they have on YouTube. You're welcome to do that. I'm already getting some questions in now, so we can ask some of the questions that you guys have. I know a lot of people have MTHFR issues, and I know this is an important topic to talk about. I'm amazed that just even in the past 2 or 3 weeks, the patients that I've spoken here in Tennessee with patients from Hawaii, and we have patients coming from Canada in another week, and I actually communicated with someone in Denmark. So it's just amazing to me how widespread MTHFR is and how many people it's affecting. So let me do one more question in regards to MTHFR, and then we'll have some audience questions, and then we'll put a conclusion on it. So one of the things that I hear, and I would say that I know just enough to be dangerous, talking with people and having a family member who has it, is I hear the word methylation all the time. That's what I think of when I think of MTHFR, something to do with methylation. Can you overmethylate?
Yes.
Okay. That was easy.
Just like almost anything else in our bodies.
Okay.
Once again, we want to stay out of the left-hand ditch or the right-hand ditch.
Right.
So there are a number of the main voices out there in the methylation world acknowledge that you can get too much methyl groups.
Right.
Just like you can, for example, in controlling DNA. So if you want a certain amount of methyl groups attached to DNA at the certain places, if you don't have enough, you might have genes expressed that you didn't want. However, it's not just an on and off switch. And I say this all the time. It's a dimmer switch. You want enough methyl groups where it slows something down to the right speed. So it's like driving through, if you're going on an interstate, they don't want you going 90, but they also don't want the person getting on the interstate and going 30 miles an hour.
Right.
So it's kind of like that with DNA. You want enough methyl groups where you're going 65 miles an hour, nice and steady. But if you get too many methyl groups and it slows it down to 30 or 45, that could be a problem. Particularly when you're looking at detoxifying. Sometimes, like we talked about estrogen, you might take out your estrogen too quick. If you use COMT, another SNP, another gene, you might actually break down some of your neurotransmitters too quick. So you could actually worsen, cause fatigue. You could cause imbalances in neurotransmitters, leading anxiety, depression, panic spells. So like I've said with Deplin, one of the reasons I don't usually use that is because the patients come to me, tried it, and they either had insomnia, they had some interesting dreams, meaning I liken it just describing sitting on the front row of a 3D movie. Which if you're paying for it, that might be fun. If you're trying to get rest,
maybe not.
Front row 3D movie might not, in super technicolor, might be a little too much. So yes, you can get too many methyl groups and cause symptoms you feel, and also symptoms you may not know about until you're already having some damage from it.
Okay, interesting. We have a couple of questions. We encourage people to write questions to YouTube channel. They can also put them on Facebook as well. But I'm just going to take one of the questions I just received from someone out there watching live, and that is this. This is actually a very interesting question because it has a buzzword that we hear of a lot in medicine. So I'll go ahead and read it. How is the body affected by vaccines if you have MTHFR?
A hot topic. I think the temperature just got a little warmer.
I think so.
Here.
I think so.
So, vaccines are much in the news, so a buzzword might be an understatement. I will be straightforward in the fact that it's a topic that I try to keep that into the private conversations, helping parents make wise decisions about choices for the children. I will say that MTHFR does play a part when I'm having discussions with parents. If they come to me and the parents have MTHFR and they haven't tested the child, or if the parents are homozygous, I know the kids got at least one of the copies of 677 or 1298. Or sometimes the kids have been tested. The parents know they've each got one copy and like, okay, well there's a chance that the kid got out of it, but they tested, or some families that have multiple kids that have MTHFR, is I'm going to take that into consideration. Is still not the biggest factor when I'm talking to parents about vaccines. So it's not like a make or break, you got MTHFR, you shouldn't have vaccines. It's one factor and something that usually I may spend 15 to 30 minutes talking to parents about. So ultimately, yes, it is a factor, but not the only one.
Okay. When people are talking about MTHFR, we had mentioned, and this is just a question it's a branch off question from someone who wrote in. We know that there are different diseases and so forth that are associated with it. When thinking of MTHFR, like in children, are we talking that they can have things such as autism or, say, bipolar disorder or these types of things that could associate with that, with MTHFR?
Yeah, there are associations between MTHFR and autism. There's no direct links because, once again, there's multiple different types of autism.
Okay.
It is something to consider. So, when you're trying to treat children with autism or the developmental disorders, or you're trying to treat adults that have anxiety, depression, who do have a definite link with MTHFR and are tested and have that, once again, you're going to approach them with a personalized plan. You're going to try to look at both treating short-term symptoms. So often it's giving the right amount of methyl groups for children with autism. And it's also getting the right amounts, but it's getting for adults, but it's also getting the other things. So it's, if I'm treating a child with autism, it's not going to be just about, here, take this B vitamin, this methylfolate, and go out the door. There's a number of other things that are going to play a part in caring for that child. But the MTHFR is going to be one of those puzzle pieces.
It's going to be one of those puzzles. Okay. It all comes down to decoding the puzzle.
Yes.
Okay. I would like to, I know we've been talking for a while, I would like to conclude our discussion tonight. People are free to continue to write in their questions as they see fit, or if they have conversations with family and friends, and they discuss the topic at hand tonight, MTHFR and functional medicine, and they have questions, or also we encourage you to write us. You can go to our website at sanctuaryfunctionalmedicine.com, sanctuaryfunctionalmedicine.com, and you'll see my email address at the very top and my phone number. I would be more than happy to speak with any of you regarding questions that you have. I think I'd like to conclude by...
There's a question that just came in.
Okay, we'll field that question while I'm looking at that. Let's talk about... because what we're talking about is very unique in the sense that we're talking about MTHFR, but we're only talking about it really in the sense of the world of functional medicine. And we talked about the reason is because the time that you invest. What I would like to know is, as a medical doctor who graduated from Vanderbilt, without going into all of the technicalities, so people have an understanding of the importance behind this. Because a lot of people are learning what functional medicine is, and many people are learning what functional medicine is simply because they have discovered that they have MTHFR. So they're now diving into this new world, and they have many questions of saying, well, I know I need help with MTHFR, and I found you, and you're a functional doctor, and I kind of get it. You spend more time, and you invest more, and there's more to be done. Is you came out of the Western medical world. Why is functional medicine so important for people to get a hold of and to understand and to use, not only for parents, but for their children? What is the importance behind this nowadays?
So functional medicine, to me, is simply what medicine should be. It shouldn't be another way of doing medicine. It should just simply be the way that we practice medicine. Treating a whole person, this way that God has made us. God didn't make us an arm separated from a leg, separated from a nose, separated from our toes. He made us all knit together, our spirit, our body, our mind, our different systems, our heart, our lungs, immune system, our endocrine system, hormonal stuff. All that fits in together. It's an intricate dance. Functional medicine simply looks at that and sees, oh, we're not just looking for, what's that one thing wrong, put a Band-Aid on it. We're trying to see how that interacts with the rest of the system. The ripples that go out from where there is a dysfunction, ripples go out, and we're addressing all those things. So treating the whole person, we're trying to get at the root cause. So root cause is not just, you got high blood pressure, take this medicine, lower it, but can we find what's causing it? Hypertension is often an inflammatory disease. Some would say it always is an inflammatory disease. And if we can find you find the fire and you put it out, that blood pressure will go down. Sometimes, the reason I say it's not always, it can be a deficiency of a vitamin. It can be also having too much of a toxin. So you find those root causes, you take them out. It's like if you go out to your yard, there's a weed. You don't just pick off the flower off the top and leave the root down there.
True.
You try to dig it up. You dig until, there's the bottom of the root. That's what we're doing. Then functional medicine is taking the best of conventional medicine and the best of complementary, alternative medicine, natural medicine, whatever you want to call it, and putting those together, which doesn't seem to be that far off crazy thing to do when if you think about the history of many of our chemotherapy drugs, were flowers in the Amazon, were some random, they'd found some chemical in, Taxols and different things and, jungles, going and finding this and then recreating it. So many of the drugs, digoxin, that came from a plant. We use that for heart failure.
Okay.
If you look at the statin drugs for cholesterol, actually the initial one was Reggie's rice. It has a form of a statin.
The initial statin drug?
Yes.
Huh.
So Reggie's rice has a chemical just like lovastatin. They just kept modifying it. And yes, they made it stronger. Sometimes they cause more side effects, but many of the medicines we have in conventional medicine really came from the natural world. So why is it? Or one of the things that there's just yesterday, someone discovered through a study that hydroxycitric acid can help dissolve kidney stones. And you're like, hydroxycitric acid, is that eating a lot of oranges? No. Who's heard of Garcinia cambogia? And I hope I'm saying the right, another big word that maybe I'm saying it right, maybe I'm not. But it's used a lot in weight loss, and there's mixed studies whether it's effective there, but there's scientific study come out now that says that can actually help dissolve patients who have kidney stones to make those kidney stones get smaller. So there was something else, there's some other studies like that where they said, in functional medicine, we talk a lot about the connection between different systems.
Right.
So the connection between the brain, the immune system, the
Right.
brain and the hormonal system. I think was either University of Virginia or Virginia Tech. Researchers found something that we never knew about. There are lymphatics, the lymph channels, like people talk about having lymph nodes, the glands swollen.
Right.
Well, there's lymph channels throughout the whole body. We just found out they're in our brain as well. And they're like, maybe this explains how a lot of our Alzheimer's, Parkinson's, neurodegenerative diseases that we knew related somehow to the immune system are tied in through this lymphatic channels. So it is simply taking what makes sense, taking cutting-edge research and trying to apply it to patient care.
Yeah.
And not waiting 20 or 30 years until it gets out in the guidelines.
Right.
Now, it doesn't mean that everything that comes off the research bench, you run out and start, hey, everybody here, start taking this.
Sure.
That can be a problem.
Sure.
But when there are enough studies that show, say, like I said, the Garcinia cambogia, that'll be something that I'll look for patients that come to me with kidney stones. That'll be something I'll probably be recommending. So there's a lot of things. Quercetin, great for allergies. Doesn't work for every single person.
Right.
But that can be very helpful for seasonal allergy or histamine intolerance. So that functional medicine is treating the whole person, looking for root causes, applying the best of conventional and the best of natural medicine, taking the time to learn enough about a patient where you can do that. It's just good medicine. I mean, many of the great physicians of old are like, if you want to know what's wrong with the patient, you should probably just listen to them. Problem is, we have a system where we don't have time.
Yeah.
Unless you step outside and say, I'm not doing it anymore.
Yeah.
I'm going to take care of the patient. I'm going to listen to a patient. I'm going to treat them with a functional medicine approach. It's really probably more what they did, in ages past. We may not have had as much technology back then, but we actually had doctors who would be able to sit down and sort through things and didn't need to order 1,000 tests and didn't need to, look to 100 guidelines. They just listened to the patient.
Sure. It sounds like it actually, ironically, or however you want to look at it, it frees you up to be a doctor, actually.
Yes.
Yeah.
It's a lot more fun.
Yeah, I bet. I think there was one more question. I want to make sure that we were getting to people's questions. Let's see if I can read.
I got one first.
Do you?
That came in.
Yeah.
On YouTube. If a mother has been diagnosed with and repeat the question.
Yeah.
So they can hear. If a mother's been diagnosed with MTHFR, would it be in the best interest of her children to have them tested as well?
I'll let you feel that.
So,
repeat that.
one of the question was about whether children, when the moms have been tested positive, whether children should be tested as well. It depends. If the mom has one copy, and if you knew dad's status, the way genetics works, if mom and dad each have a copy, there's a 25% chance the kid could have two. There's a 50% chance they'll have at least one, and there's a 25% chance they will have neither. Now, if you take one parent that has two copies, you're guaranteed the kid's going to have at least one copy.
Wow.
So it kind of depends. At the very least, you're going to want to think about that child starting on methylfolate, methylated B vitamins, rather than, that's one of the issues that has come up with some of the autism studies, is there was a recent study that kind of raised the flag, moms who take methylfolate, there's a slight increased risk of autism. Well, Ben Lynch from MTHFR, Seeking Health Education Institute, talked about this long ago. I heard him talk about this multiple times, is the fact that were probably children, babies who would have otherwise been miscarried because of their MTHFR status are actually now surviving the pregnancy and being born, but mom's gone through, she's taken the right prenatal, she's taken methylfolate. What happens when she has the baby?
There's an issue.
She doesn't give the child methylfolate.
Yep.
Or she stops taking it. Oh, it's fine. So she's not sending it out through her breast milk. Or if she's formula feeding, the child's not getting enough methylfolate. They're
Sure.
getting folic acid. There is good reason to think that it's more to do with the fact that there's not sufficient continued methylfolate given the child. So if you're wanting to know whether or not that you're going to give your child, you know you have it, the mom or the dad knows they have that gene. If you don't want to check, just make sure your child's getting enough methylfolate. If you want to say, oh, well, do we really need to? It won't hurt them anyway, but if you want to know, just check.
Right.
Like I
Right.
said, there's some simple tests out there now that you can do
Sure.
just to find that out.
Sure. Absolutely. A few more have just come in. I'm going to make sure we address as many as we can. And let's see here. Would MTHFR be a contributing factor for CPTSD? I think I'm getting that right. I know sometimes it comes in different ways.
I'm not sure. Say that again.
Would MTHFR be a contributing factor for CPTSD?
Now, part of it is if that's childhood post-traumatic stress disorder.
C-PTSD, if that helps.
That might be. Hopefully, I'm answering the right question.
Okay.
So, if it has to do with post-traumatic stress disorder, it's PTSD. MTHFR can be one of those. There's another gene, COMT, that affects your neurotransmitters, particularly dopamine, norepinephrine, and epinephrine. That in studies have a little higher correlation. It's not a one-to-one. It's still, like I said, that dimmer switch where you kind of increase or lower the chances of different things, some psychiatric things. But the COMT is probably a little more related.
Okay.
There was some look at the MAO gene. I've seen mixed results on that, whether that actually plays a part in schizophrenia, PTSD, panic disorder, anxiety. But there are some studies that suggest that. So MTHFR probably is not the biggest or even a major player in that. It's
Okay.
more related to some of the other genetics that you can get on like 23andMe.
Okay. Got another one here. If there's anyone that come in, you just let me know, David. But here's the other one we just received. So this person says they have zinc poisoning from a denture adhesive 5 years ago. Took a year for doctors to figure it out. Now I have neuropathy, and the neurologist can't figure out why I've continued to get worse. If it says I do anything if someone can help me. So is that something that you look into in terms of zinc poisoning? Have you heard of such a thing as zinc poisoning?
Well, first of all, I do want to say this is not really the setting for to give specific medical advice. All these things are educational purpose.
Sure.
Help people understand their health.
Sure.
Hopefully talk to their own doctor if they're seeing me. Hopefully answer some questions if I didn't do it in the office. So trying to venture out, once again, having, a couple of sentences on a patient's history is not going to be enough for me to tell. Now, there's things that go through my head
Sure.
that I think about.
Sure.
But there's a whole series of questions I would need to ask for a patient like that.
Absolutely.
So anytime, once again, it's the principle. You can have too much of a good thing. You can
Yeah.
have too much zinc. You have too much potassium can kill you.
Wow.
There's been great murders, murder mysteries through somebody overdosing somebody with potassium.
Wow.
So anything can be an issue if there's too much of it. Some of the B vitamins you can get neuropathy from if you get too much of. So I would want for that patient to make sure, is that the only thing? Is that the only piece of the puzzle? And sometimes it is. It's nice when you look down, there's one suspect, they're guilty, that's
right.
it.
Case closed.
Usually it's a
Right.
game you're dealing with. You're dealing with the multiple puzzle pieces. So it would need to look and see, all right, is it just zinc? Are there other metals? Has the zinc thrown the copper ratio off?
Right.
are they deficient in something like alpha lipoic acid? Do they have other histamine issues? Are they able to detox? Is that zinc interfering with the detox? So there's so many different directions that, I mean, that's why I would take, I'd spend 45 minutes to an hour walking through all those questions to try to see how to help that person. And I'm very sorry. And caring for patients with neuropathy,
Right.
I think a good way a lot of them might describe it is, it's like, we hit our funny bone, it lasts for a few minutes, it's really painful, sometimes it feels like your hand's on fire.
Right.
Imagine if you have that kind of tingling weeks and months and sometimes even years.
Yeah.
It's debilitating.
Sure.
So I do deal with patients with a lot of neuropathy.
Okay.
Dealing with too much vitamins, too little vitamins, too much minerals, too much toxic metals. So a lot of those things, and there are some therapies out there that can help. Once again, those therapies depend on what's underlying the root cause. So I hope that patient is able to find some help. I'm willing to try to help them in the office, but it would be a disservice to try to simplify that too much.
Sure, absolutely. Well, I think we spent a good deal of time getting to the root issues of MTHFR tonight. Is there any more questions?
Yeah.
Or are there any more questions?
There's one on YouTube. How does MTHFR affect Graves' disease?
Graves' disease.
You might want to repeat it.
So MTHFR and Graves' disease, there's some different interactions between thyroid and your MTHFR. So you need adequate thyroid to convert some of your B vitamins, which then you need those B vitamins for the methylation cycle to work. So inadequate low thyroid could slow the B vitamin. So you might take enough in, but it's not activated, so it's not working. Now, on the other hand, Graves' disease is a condition where you have too much thyroid hormone. So it's kind of like slamming on the gas, and you can't slow things down. So your heart rate goes up, you lose weight, often you can't sleep. So there's a lot of other issues, heart rate, palpitations, things like that. I'm not aware. There may be, like they're discovering more, and I've read tons, but there's still always things I'm finding. Somebody comes and says, "Oh, look at this article. This may be connecting things." They're like, "Okay, let's take everything with a grain of salt. I'll take that. I'll look through it, look up articles. If there's one article out there in the world that's saying something, I'm not going to do a whole lot of changes in how I practice. But often that's the opening to the rabbit hole. You look at that one article and you look up and like, oh, well, there's another one and another one and another one. So I would have to look into that connection. I haven't seen that myself, but if I had a patient with that, be another opportunity to do some research.
Yep, that's good. Are there any more, David, that you sent? We are going to stop there tonight. If you have further questions and you speak with people that have questions, I want to encourage you all to go to sanctuaryfunctionalmedicine.com. sanctuaryfunctionalmedicine.com. My email's at the top. My cell phone is at the top for new patients. If all you want to do is talk to me and ask some more questions, I'd be happy to speak with you. If for any reason I don't have a specific answer for you at the tip of my tongue, I will get one for you. So we really appreciate that you tuned in. We know that these are important topics to discuss. One of the things I'd like to close with is to let you know that one of the things that's special about Sanctuary is it's one of the few places I think that you'll see two things happen. You see a lot of doctors who have knowledge, and you expect that. And we've all had those doctors who have had knowledge to certain degrees, but I think it's very, very rare and very unique to see doctors who have knowledge and wisdom. And they're two different things. And one of the attributes of wisdom, I believe, is to have humility and not let knowledge go to your head and be full of pride. And it's an absolute honor to be able to work for someone like Dr. Potter, who has wisdom and knowledge, to be able to come to him as a patient, which I and my wife are both patients, and to reason with him and say, would you consider this or would you consider that, and not be talked down to. We have found that that's a rarity. So if you are looking for a doctor like that, if you are looking to reason with a doctor and be able to say, I've studied certain things, can I present them to you, and not be shunned not be talked down to and have the doctor do the thinking for you and just dismiss you altogether. I would encourage you to go to Sanctuary Functional Medicine. I would love to talk with you, encourage you, give you answers, and help you to be as informed as you can about MTHFR, thyroid issues, whatever it is that you're struggling with that you have not reached a conclusion to in your Western medical world. Take the time to look at functional medicine and have a doctor invest in you like this. So thank you again. Hope you have a great night, and we look forward to speaking with you soon on another topic. Have a great night.
Thank you for being with us tonight, and thank you, Stephen, for being my interviewer and asking those questions. And thank you to all those that have been sending questions in. I look forward to more opportunities to help people understand their health. It's an honor and a pleasure to be able to care for God's creations and be able to, my hope and prayer is that I can be a blessing to others to take what God has given me in terms of the knowledge and wisdom and to care for others in a way that helps them walk through difficult times, trials, storms, sufferings, and find relief and bring hope when it's been hopeless times in the past. So I look forward to meeting with you in person someday maybe, or just, asking questions on the internet. And I can't play your doctor without being your doctor, but I do like to take these opportunities to educate. So I look forward, and I thank David also, who has been our videographer and handling the computer. So enjoyed it very much tonight and look forward to meeting you.
Thank you very much, guys. Have a good night.